The fluorescent lights hummed their constant electric drone as Elena Martinez pushed through the staff entrance at St. Michael's, her badge catching the overhead glare for just an instant before disappearing beneath her collar. Norfolk's early morning air clung to her scrubs, salt from the harbor mixed with the industrial smell of the parking lot, and she breathed it in like a soldier checking her perimeter before stepping into hostile territory. Except the territory was just a hospital. Except the hostility was just a man named Dr. Pierce. She moved through the corridors with the measured efficiency of someone who'd once run a field surgical unit outside Bagram with 3 surgeons, 2 operating tables, and a Taliban mortar round landing 70 meters away. The linoleum under her sneakers was cold and clean. The hallway smelled like antiseptic and hand sanitizer and something underneath that she recognized from 18 months of 4 a.m. shift changes, the particular exhaustion of people keeping other people alive. Her hands were steady as she clipped her stethoscope into place, checked her pocket for the ballpoint pen, and moved toward the medication cart with the quiet precision of someone who'd learned long ago that silence was safer than sound. The night shift had left 3 patients with 4 lines that needed adjusting and a cardiac case in room 307 whose chart she needed to review before rounds. Elena pulled up the digital file on the terminal, her eyes moving across the screen with the focused intensity she'd perfected over 15 years in medicine, 6 in the field, 9 in civilian facilities that still felt temporary, like she was always about to pack a duffel and board a transport plane. The orders were dated midnight. Dr. Pierce had written them during his solo night coverage. She read through the dosage for the digoxin, then read it again, her jaw tightening so slightly that someone standing directly in front of her would have missed it. The calculation was wrong. Not by much. Not obviously wrong. Wrong in the way that killed people quietly over the course of 3 or 4 days while everyone assumed it was the underlying condition. Elena didn't pause. She didn't sigh. She pulled up the chart notation system and entered her observation in the same neutral language she always used, dose calculation verification recommended for cardiac glycoside protocol. See previous orders for comparison baseline. She timestamped it at 6:02 a.m., saved it, and moved toward room 307 without letting her breathing change. The patient was sleeping, his oxygen saturation steady at 94%, his monitor showing the regular rhythm that meant nothing was actively trying to kill him in this moment. She adjusted the 4-drip line with gloved fingers that had held pressure on hemorrhaging femoral arteries and started central lines in moving vehicles and once, exactly once, maintained a manual airway for 17 minutes while a helicopter descended through a dust storm that reduced visibility to 3 feet. Her hands remembered. Her hands would always remember. But her face remained calm as she documented the adjustment and moved to the next room. The pen in her breast pocket felt heavier than it should, considering it weighed almost nothing. It was just a ballpoint. Blue ink. Clipped to her scrubs the way it had been clipped to her scrubs for 4 years, ever since the day she'd used an identical pen for a needle decompression on a patient whose name she'd never learned, whose family she'd never met, whose death had come anyway 6 hours later from complications that had nothing to do with her or the pen or the fact that she'd tried everything. The pen was routine now. The pen was muscle memory. The pen was the kind of thing that stayed with you after you'd learned what it could do in an emergency. At 6:58 a.m., Elena opened her locker on the 4th floor near the break room. The space was small, utilitarian, lined with exactly 3 personal items, a sweater for the cold operating rooms, a pair of backup sneakers, and a folded flag that had been pressed and refolded so many times the creases had worn soft. The nameplate on the flag read SSG Maria Ramos, and beneath that, a ribbon rosette from a medal she'd never gotten to see Maria wear. Elena's fingers touched the corner of the fabric, just the corner, just for 2 seconds, and the tightening in her jaw returned and disappeared like the flick of a switch. Discipline. That was what the flag meant. That was what the flag had always meant. Emotion was a luxury she couldn't afford. Emotion got people killed. Emotion had gotten Maria killed, and it had been Elena's job to stop feeling anything about that particular fact at approximately 0430 hours on a morning she refused to think about anymore. She closed the locker. She checked her watch, 7:03 a.m. Rounds would begin at 7:30. Dr. Pierce would arrive at 7:27, moving through the hallways with the careless confidence of a man who'd never been questioned because his credentials were better than anyone else's in the building and his family had been doctors since there were buildings to practice in. Elena had read his personnel file. Not because she had access to his personnel file, she didn't, but because information was the most important weapon she'd ever learned to gather, and gathering information was simply what she did now. Dr. James Pierce, 47, Johns Hopkins Medical School, postgraduate fellowship at Stanford, father was a cardiovascular surgeon, mother was a hospital administrator. He'd worked at St. Michael's for 8 years. He had a reputation for brilliance and a reputation for intolerance, and the two reputations existed in a tight symbiosis that meant his patients mostly got good outcomes and his staff mostly got crushed underneath his certainty that he was the only person in any given room who actually knew what he was doing. He had no idea who he was looking at when he saw Elena Martinez in her scrubs with her eyes down and her hands moving with practiced efficiency through her pre-rounds preparation. He saw a quiet Latina nurse who'd transferred 6 months ago from a facility in Virginia nobody'd heard of. He saw someone young enough to still be idealistic about nursing, which meant she'd be deferential enough to accept his corrections without argument. He saw someone he could use as an example of why nurses needed to stay in their lane. He did not see the 4 surgical scars hidden beneath her long sleeves, or the muscle memory encoded in her hands, or the 43 days she'd spent in a field hospital with 2 surgeons and no air support and the Taliban using her position coordinates as a training exercise. Elena was at room 405 when the elevator doors opened and Dr. Pierce emerged with his tablet and his white coat that had never been worn in an actual emergency. She felt his gaze land on her the way she felt wind changes, a shift in pressure, a warning system that had been fine-tuned across 18 months of having mortar rounds land close enough to feel the percussion in her teeth. She didn't look up. She documented the vital signs for her current patient and moved to the next without acknowledging his presence. This was the safe response. This was the response that meant she could continue doing what she'd come to St. Michael's to do, which was her job, which was taking care of people, which was monitoring one particular Special Forces major named David Chen in room 412 without revealing that his commanding officer was her son's mother, without revealing that she'd been given direct orders from the Pentagon to ensure his recovery while maintaining her cover as a civilian nurse with a fabricated background and a carefully constructed identity that was already beginning to feel thinner than the scrubs she was wearing. The admissions had come in at 4 a.m. Elena had seen the name, David Chen, Major, Special Forces Command, and her hands had stopped moving for exactly 3 seconds before she'd forced them to resume their normal rhythm. She'd read the intake notes, recurring chest pain, post-mission medical monitoring, request for privacy and discretion regarding military affiliation. The Pentagon's language. The Pentagon's protection. The Pentagon's way of saying she'd been activated for the first time in 3 years and that the stakes were the kind of stakes that meant her son Marco's commanding officer was now her patient and she couldn't tell anyone why that mattered or why she'd already memorized his EKG results and why she was going to spend the next 2 weeks, or 2 months, or 2 years, depending on the briefing she hadn't received yet, keeping him alive without revealing that she'd spent 18 months learning how to keep people alive in conditions that would break most people into smaller, simpler pieces. Dr. Pierce passed her in the hallway at 7:19 a.m., moving toward the patient rooms with the purposeful stride of someone accustomed to being obeyed. He didn't acknowledge her. She didn't acknowledge him. But she felt the dismissal like a weight, like crosshairs, like the moment before something you've learned to anticipate finally arrives. She had 7 minutes before rounds. She had 3 patients to check. She had a folder of medical information to review and a mission briefing that was written in the gaps between what she'd been told and what she could infer from the pattern of her own life, which had taught her to read between lines that most people didn't even know were there. Elena moved toward room 412 with the steady precision of a soldier moving toward an objective. The door was closed. The lights were off. Inside, David Chen would be sleeping or pretending to sleep or lying awake in the dark the way people did when they'd spent enough of their lives in combat to understand that sleep was a privilege that came with a warranty that could be revoked at any moment. She didn't open the door. She didn't need to. The briefing had included his vitals, his medical history, his service record, and the single most important detail, Marco had called his CO the best man I've ever served under, which meant David Chen had gotten her son home alive through 3 tours of Afghanistan and Syria and a deployment to the Horn of Africa that still made Elena's hands go cold when she thought about it too long. That was why she was here. That was why the Pentagon had reactivated her cover. That was why the folded flag in her locker had stopped being a memorial and started being a promise. The fluorescent lights hummed their constant drone. Dr. Pierce's footsteps echoed from the hallway, coming closer, coming for his morning rounds, coming for his chance to remind the nursing staff of their place in the hierarchy of medicine. Elena checked her pen one more time, checked her gloves, checked the steadiness of her hands, and prepared herself for 8 hours of being underestimated by a man who'd never learn what she'd learned at Bagram, that the quietest person in the room is sometimes the only one who knows how to survive. Dr. Pierce called her a diversity hire during grand rounds, and nobody stopped him. 12 residents and 4 attending physicians stood in a semicircle around room 307 while Pierce held up Elena's chart notations like evidence at a trial. His voice carried the particular cruelty of a man who'd never been contradicted by someone who mattered. Note here how our floor nurse has documented concerns about medication interactions, he read aloud, his tone suggesting he was translating a child's finger painting. Perhaps she missed the day in nursing school where they taught the difference between clinical observation and medical diagnosis. The resident smirked in perfect synchronization. Pierce circled Elena's station, his Italian leather shoes clicking against the tile floor in a rhythm that felt like a metronome counting down toward something violent. He gestured with the chart as though conducting an orchestra of contempt. This is what happens when we prioritize filling quotas over filling competencies. Ms. Martinez represents the participation trophy generation of healthcare. Everyone gets to play doctor. Elena's jaw muscle twitched once. Just once. Then it stilled. She continued preparing medications, her hands moving with the kind of steady precision that came from years of working under conditions where trembling meant someone died. Her eye stayed on her work, the 4 lines arranged in perfect order, the medication labels aligned, the documentation precise enough to survive a lawsuit or a battlefield inspection. Her pen didn't waver as she signed off on the next chart, the signature clean and authoritative despite every fiber of her body knowing that anything less than total composure would give Pierce exactly what he wanted, proof that she could be broken. The oxygen was silence. She breathed through it like a submersed dive, calm and controlled, letting the pressure settle on her shoulders the way it had settled countless times before in places where showing emotion was a luxury that got people killed. What happened next didn't just test her composure. It changed everything. That afternoon, Elena approached the 3rd-floor vending machine and found Sarah Chen and Jennifer Morales mid-conversation, their voices pitched low with the kind of conspiracy that only forms when someone decides to weaponize their words. They went silent when they saw her, the transition so abrupt it was like someone had cut audio from a film. Sarah selected her chips with deliberate slowness, examining each option as though the vending machine contained the secrets of the universe. Her hand lingered on the lays. Jennifer shifted her weight, and then the words came, just loud enough to reach Elena's ears. Some people get hired for what they look like on the diversity reports, not what they can actually do in real medicine. The fluorescent lights overhead buzzed in response, a sound like angry wasps trapped in a plastic shell. Elena fed her dollar into the machine. The bill caught, then released with a mechanical shudder. She pressed the code for her granola bar, B7, and listened to the metal spiral turn, watched her selection tumble into the collection slot. Her knuckles were white around the wrapper as she walked away, but her pace was steady, her breathing controlled, her face displaying the kind of neutral expression that had been carefully constructed over years of being underestimated by people who'd never survived what she'd survived. She didn't need to respond to them. Their words were noise from people who still believed that credentials meant competence, that a white coat was armor instead of costume. Elena had held a trauma patient's abdomen together with her hands while artillery shook the walls. She had intubated a 14-year-old girl with a crush injury while rounds exploded outside the tent. She had held 3 surgeons together through 18 hours without sleep while the Taliban tested the perimeter. These 2 nurses with their whispered cruelties were not her measure of anything. But the poison was working. By evening, she could feel it moving through the hospital's bloodstream, the way people's eyes didn't quite meet hers anymore, the way conversations shifted when she walked past, the way even nurses who'd been friendly began creating distance like she was contagious. Later that same evening, when Elena quietly approached Dr. Pierce at the medication station and pointed out his calculation error on the digoxin dose for the patient in room 307, she kept her voice low, her manner deferential, her notepad positioned so only he could see the numbers, 0.25 milligrams too high, a difference that could trigger arrhythmia, a difference that mattered. Pierce's face went crimson. Not flushed. Not embarrassed. Crimson with the particular rage of a man who realized he'd been corrected by someone he'd designated as beneath correction. He stepped close enough that Elena could smell his coffee breath, the acidity of it mixing with cologne that cost more than her monthly car payment. "If you question my orders again, Ms. Martinez, I will have security escort you from this building." His voice had dropped to the register of a threat made in whispers, which was how you knew it was real. "Do you understand, or do I need to use smaller words?" Elena met his eyes with that unnerving steadiness, the same expression she'd worn when a colonel tried to pull her team from the field hospital at Bagram 3 hours before the Taliban assault. Her voice came out level, almost conversational, "I understand." Then she made a note in the chart. Time-stamped. Initialed. Documenting the original calculation in Pierce's handwriting, her notation of the error, and the timestamp showing she'd identified it. It was called defensive documentation, and it was hospital policy, and it meant that if something went wrong, there was a paper trail proving that she'd done her job while he'd done his. Pierce's eyes promised consequences that were beyond professional retaliation. They promised the kind of systematic destruction that came from someone with institutional power who felt humiliated by someone he'd designated as powerless. He walked away without another word, which was worse than if he'd stayed. The new admission arrived at 1,400 hours the next afternoon, wheeled through the double doors on a stretcher that squeaked its warning in the quiet hallway. Major David Chen, Special Forces, post-mission medical monitoring for recurring chest pain and arrhythmia following a training accident that the chart described in carefully neutral language that told Elena nothing except what someone wanted her to know. Elena stood at the nurse's station as the orderlies wheeled him past, and her tablet nearly slipped from her hands. This was Marco's commanding officer. This was the man her 8-year-old son had a photograph of on his bedroom wall, the man Marco talked about at dinner with the kind of reverence usually reserved for superheroes. Major Dave promised to teach Marco not tying. Major Dave had let Marco wear his combat boots once, just around the living room. Major Dave was the reason her son wanted to be brave. Elena's hand went to her pocket where her phone held Marco's last text, sent that morning before school. "Is Major Dave gonna be okay? He promised to teach me not tying." Her fingers found the folded flag instead, the one made from the uniform of her fallen teammate, the one that had been her talisman through every moment of underestimation and contempt and isolation. She held it there for 3 seconds, using it the way she'd learned to use it, as an anchor, as a reminder that she'd survived worse, as a physical manifestation of why she couldn't afford to break. The assignment from Pentagon intelligence had been clear: monitor military patient transfers at St. Michael's for potential security breaches. Someone had been leaking classified patient information to foreign contacts. Chen's admission was the bait. She was supposed to observe, document, remain invisible. Gather intelligence. Report to her handler. Keep the operation clean. But now it was personal, and the line between mission and maternal instinct became a blurred thing that Elena couldn't quite define. She reviewed his chart in the break room, sitting alone, coffee growing cold beside her. Unstable angina. History of combat stress. Medication regimen that made her medic instincts twitch in ways her nurse credentials weren't supposed to notice. Something was wrong with his treatment plan, but she couldn't identify what, couldn't isolate the variable, couldn't see the shape of the threat yet. Pierce assigned her to Chen's care rotation with a thin smile that carried all the elegance of a knife wrapped in velvet. "Since you're so concerned about cardiac cases, Martinez, let's see your expertise in action." It was sabotage dressed up as opportunity. It was the strategic move of someone who decided that Elena's competence was a threat that needed to be eliminated through proximity to failure. That night, Elena sat in her car in the parking garage for 20 minutes, the engine off, the the darkness complete except for the ambient light bleeding through from the street lamps outside. She stared at her phone, Marco's messages glowing in the dark like something alive, like something demanding a decision she wasn't prepared to make. She could not blow her cover. The Pentagon had spent resources on this operation, had embedded her in this hospital with a carefully constructed civilian identity, had made calculated decisions about risk and benefit that didn't include an 8-year-old boy's knot-tying lessons. She could not let Chen die. The calculus didn't work that way, not for her, not anymore. Her son's commanding officer was lying in a hospital bed with a treatment plan that was slowly poisoning him, and she was supposed to watch it happen with professional detachment. She could not explain to Marco why she'd failed to save the man he idolized. There was no explanation that would work, no story that would make sense, no way to tell her son that sometimes being brave meant letting people die to preserve operational security. The mission parameters hadn't accounted for this collision of duty and love, and neither had her heart. She drove home through the rain that hammered the windshield like applause, thinking about needle decompression, thinking about the ballpoint pen in her pocket, thinking about the specific angle at the second intercostal space where a person could push back against death if they had nothing left to lose. The second day dawned with Elena already positioned in room for 12 before the morning shift briefing, her trained eye cataloging every detail that most floor nurses would gloss over. Major Chen slept restlessly, his chest rising and falling in rhythms that her 5 years in combat medicine recognized immediately as wrong. She didn't flinch at the recognition. She simply opened her notebook and began recording what her instincts were screaming. Respiratory rate at 0600 hours, 16 breaths per minute. Within normal range. Within the range that would make any standard hospital floor nurse smile and move on to the next patient. Elena was not a standard floor nurse, and she did not move on. By noon, when she returned from her rotation in the orthopedic wing, a rotation Dr. Pierce had carefully arranged to limit her access to Chen, the numbers had begun their climb. 18 breaths per minute. The ventilator was off. Chen was breathing entirely on his own, which meant his body was working harder than it should. Much harder. She made a notation in the chart, timestamp precise, 1,147 hours, respiratory rate climbing despite stable oxygen saturation. Post-op day 2. No signs of infection. No fever. Just a man whose lungs were laboring against something invisible, something mechanical, something that would kill him if left unchecked. Elena moved through the hospital corridors with the measured calm that had carried her through 18-hour surgical shifts while the Taliban mortared the compound outside. The folded flag rested against her ribs, tucked in the chest pocket of her scrubs beneath the unbuttoned white coat Pierce had made a point of saying she didn't quite earn. She pressed her hand against it briefly, a gesture no one would recognize, and continued to Chen's room. She checked the monitors. Oxygen saturation, 96%. Still stable. Still safe. Not yet. The clock moved forward. Lunch came and went. Elena picked at a container of yogurt in the break room while pretending not to notice the way other nurses lowered their voices when she entered, the residual poison from Pierce's grand rounds humiliation hanging in the air like something medical. One of them, the one who'd muttered about diversity hires at the vending machine, actually looked away. Elena didn't acknowledge it. Acknowledgement required emotion. Emotion was a luxury she couldn't afford, and Major David Chen didn't have time for her to indulge in it. She was back in room for 12 at 1,400 hours, ostensibly retrieving a blood pressure cuff she'd left behind. Chen's eyes were open, foggy from the pain medication Pierce had ordered, but aware enough to track her movements. Elena's hands moved with mechanical precision as she checked vitals, recorded numbers, moved with the choreography of a perfectly competent floor nurse who was doing nothing more than her job. But her eyes were reading something different. The respiratory rate had climbed to 20 breaths per minute. The effort was visible now, the way Chen's muscles were engaging around his ribs, the subtle retractions at the intercostal spaces that meant his body was having to work to pull air into his lungs. Something was blocking that air. Something was preventing normal expansion. Elena's jaw tightened, almost imperceptibly. She'd seen this pattern before. She'd treated this pattern before. In a field hospital outside Bagram, with rounds hitting the concrete walls and 3 surgeons evacuating and her hand steady as surgical steel, she'd kept men alive through exactly this progression. Tension pneumothorax. Air in the pleural space with nowhere to escape, compressing the lungs, collapsing them gradually, methodically, like a hand slowly closing around a throat. The difference was that in Bagram, she'd had authority. Here, she was just a nurse. Here, she was a diversity hire who didn't understand rail medicine. She documented the respiratory rate change in military time, 1,402 hours, 20 breaths per minute, patient displaying increased work of breathing, subcutaneous emphysema noted on right anterior chest wall. The documentation was meticulous, exact, undeniable. She highlighted it. She added a note requesting urgent diagnostic imaging, chest X-ray, ideally a CT scan with contrast. She highlighted that too. Then she walked the chart directly to Dr. Pierce, who was standing at the nurse's station reviewing admission papers with the glacial confidence of a man who'd never been wrong and never intended to be. Major Chen's respiratory rate is climbing, Elena said. Her voice was level, flat, the voice of someone reporting weather. 16 at 0600, now at 20 breaths per minute. Oxygen saturation still holding at 96, but the pattern concerns me. I'd like to recommend a chest X-ray. Pierce didn't look up from his papers. Post-surgical anxiety manifesting as hyperventilation. Extremely common. Increase his anxiolytics to calm the hyperventilation and the rate will normalize. Case closed. The fluorescent lights buzzed overhead with the sound of electricity turning words into something disposable. Elena didn't move. The pattern isn't anxiety, she said. The subcutaneous emphysema on the right side suggests. What I suggest, Ms. Martinez, is that you remember your scope of practice. Now he looked up, and his eyes held the satisfaction of a man who'd been waiting for an excuse to use the word again. You are a floor nurse. You are not a diagnostician. If you cannot follow a physician's orders without playing medical detective, I can have you removed from this unit. Is that understood? Elena understood many things in that moment. She understood that Pierce had already decided he was right and the evidence was irrelevant. She understood that her training meant nothing in a hierarchy that measured authority by the letters after a name rather than by the lives saved. She understood that Chen was going to deteriorate and no one was going to see it coming because the one person in this hospital who would be systematically silenced. She understood, most importantly, that she could not afford to show understanding, because understanding looked like defiance, and defiance would get her pulled from his case entirely. Understood, she said quietly. She turned and walked away, her composure intact, her hand steady, her heartbeat a controlled rhythm that would have impressed any cardiac monitor. But at 18:15 hours, when Pierce made the phone call to the director of nursing from his office, a call Elena heard him make because she'd positioned herself in the supply closet directly adjacent to his office, her military training translating ordinary hospital protocol into intelligence gathering, her composure began to develop fractures. Pierce's voice came through the thin walls like something broadcast directly into her chest. Ms. Martinez is overstepping her scope, creating unnecessary anxiety with unfounded diagnostic concerns. I recommend removing her from the cardiothoracic recovery rotation. She's becoming a liability. The director agreed immediately. By 1900 hours, Elena had been pulled from Chen's care and reassigned to orthopedics, a quiet, stable floor where her combat instincts could do no harm, where her observations would matter to no one, where she would not be in room for 12 when something critical happened. Pierce had just moved a piece on a chessboard he didn't understand he was playing, and he'd moved it with the kind of casual competence that made him genuinely dangerous. He wasn't just arrogant. He was strategically vicious, and he'd used hospital politics like a scalpel. Elena changed into fresh scrubs in the employee locker room and pressed her forehead against the cool metal of her locker door for exactly 5 seconds. The folded flag was still there, tucked beside her parking pass and the protein bar she never ate. She touched it with 2 fingers, a gesture that looked like nothing but meant everything, and then she texted her Pentagon handler, asset compromised. Patient in immediate danger. Request authorization to break cover. The response took 11 minutes. 11 minutes during which Elena sat in the orthopedic wing distributing pain medication to patients with broken femurs and hip replacements, her body executing its duties while her mind remained entirely in room for 12 across the floor. 11 minutes of watching the clock. 11 minutes of knowing that Major David Chen, her son's commanding officer, her secret assignment, her impossible responsibility, was being systematically sedated while his lungs slowly collapsed. The message came through her personal phone, encrypted and cold: maintain cover. Surveillance takes priority. Do not interfere. Elena stared at those words, 7 words that had just ordered her to watch a man die, and felt something shift inside her chest like continental plates moving. The mission and the man had just collided, and she was standing at the exact point of impact. Her training had been absolute: the mission comes first. Always. The mission is bigger than individual lives. The mission is what matters. She'd followed that training for 12 years. 3 tours. 2 Purple Hearts. She'd held a surgical unit together for 18 hours while bombs fell. She'd made decisions that meant some men lived and others died, all in service of the mission. She'd earned a medal for that. A silver star for choosing the mission over mercy, over individual attachment, over the impossible weight of choosing who deserved salvation. But that was before she had a son. That was before Major David Chen became the man who taught her son what it meant to lead. That was before the mission came home to Norfolk, Virginia, and asked her to watch while a doctor with a God complex systematically silenced the only person who could save a life. Elena's hand started to shake. Actually shake. Not metaphorically. Literally. Her fingers trembled as she held a medication cup, trembled as she administered an injection, trembled as she realized that the trembling wasn't fear. It was restraint. The code blue alarm shattered the night shift silence at 02 for 7 hours like incoming mortars, and Elena was moving before her conscious mind registered the sound. Her body responded the way it had at Bagram: instinct, muscle memory, 18 years of knowing that hesitation measured in seconds could mean death. She reached room for 12 before the crash cart, shouldering past the night resident frozen in the doorway like a sculpture of panic. Major Chen was grey-lipped and gasping, his neck veins distended like ropes under his skin, trachea visibly deviated to the left. Tension pneumothorax. 90 seconds before cardiac arrest. Maybe less. Elena's hands moved with the balletic precision of someone who'd performed this procedure in a field hospital outside Bagram while incoming rounds hammered the perimeter walls. She grabbed the ballpoint pen from her pocket, the same brand she'd carried through 3 combat deployments, the pen that had become as essential as her stethoscope, and a 14-gauge catheter from the crash cart in one fluid motion. Second intercostal space. Midclavicular line. The anatomical landmarks were burned into her nervous system like muscle memory. She didn't hesitate. She didn't announce her actions to the resident standing frozen in the doorway. She simply acted. The pen barrel pierced skin with a soft resistance, and the catheter followed through the pleural space. The hiss of released pressure was audible throughout the room, a sound like air escaping from a tire, but this hiss meant life, meant oxygen flowing back into compressed lung tissue, meant a man wasn't going to die on her watch. Chen's oxygen saturation climbed from 62% to 81% to 94%. His color returned like someone was slowly turning up the brightness on a darkened photograph. His breathing steadied from panic gasping to something almost normal. Elena's hands remained rock-steady as she secured the catheter with tape, her face showing nothing, a mask of professional composure so complete that the nurses standing in the doorway couldn't tell if she'd just performed an emergency surgical intervention or checked a bedside monitor. Her heart hammered so hard she could feel it in her throat, but her voice was flat as she spoke to the respiratory therapist, "Get me a chest X-ray. Portable. Now." The room erupted into controlled motion, nurses moving, residents finally unfrozen, the crash cart backing out of the room. Elena stood beside Chen's bed with one hand resting on the side rail, watching his monitor climb toward sinus rhythm, watching his eyes flutter open with returning consciousness. He didn't recognize her. Wasn't supposed to recognize her. She was just a nurse who happened to be standing in the right place at the right time, and she kept her expression neutral even as she saw the confusion in his eyes settle into something like relief. Dr. Pierce arrived 23 minutes later. Elena was documenting in the chart when she felt the temperature of the room shift. She didn't look up, but she heard the sharp intake of breath, the pause as Pierce processed what he was seeing: Major Chen stable, oxygenating, a catheter secured at the chest wall, vital signs climbing back to normal. The crash cart still stood at the foot of the bed like evidence of a disaster averted. Pierce's face moved through a series of expressions: confusion, then calculation, then something colder and more dangerous. His eyes found Elena across the room, and she watched him piece together what had happened here. She watched him understand that she had done something extraordinary, and more importantly, she watched him understand that everyone in this hospital now knew it. He didn't speak. He just looked at her with the expression of a man watching his carefully constructed world develop hairline fractures. By 0800 hours, the fractures had become chasms. Pierce activated his network like a man detonating a series of controlled explosions. He called the board members personally, 3 calls, each one lasting exactly 4 minutes, each one describing a dangerous scope violation by an unlicensed practitioner performing emergency procedures without physician authorization. He contacted the nursing program listed on Elena's cover story resume, requesting urgent credential verification. He filed a formal complaint with the state licensing board and demanded an outside investigator. Elena heard the footsteps coming down the corridor toward her station at 1400 hours. She knew what was coming before the administrator appeared with the investigator in tow, a woman in a grey suit carrying a briefcase and an expression that suggested she'd already been poisoned against Elena by whatever Pierce had told her on the phone. "Captain Martinez," the administrator said, and Elena's blood went cold because she'd never heard the administrator use that tone with her before: clinical, distant, the voice of someone protecting an institution rather than protecting her staff. "We need you to come with us. Now." Elena followed them to the director's office in silence, her badge still clipped to her scrubs, her access key card still in her pocket. She knew how this worked. She'd seen it happen to others who'd stepped outside their prescribed role, who'd done something the hierarchy hadn't explicitly authorized, who'd saved a life in a way that made the wrong people uncomfortable. The investigator asked her to surrender her badge and key card. Elena removed them without comment and placed them on the desk. The words "suspended pending investigation" felt like bullets finding their marks, each one calculating, each one precisely aimed. She drove home in silence, still wearing her scrubs, still wearing the weight of what she'd done and what she'd cost by doing it. Marco found her at the kitchen table at 1847 hours, still in scrubs, crying silently, the first tears she'd allowed herself since the flag ceremony for SSG Ramos, since she'd accepted the folded triangle from a commanding officer who could barely meet her eyes. Marco's voice was small and frightened in a way that broke her apart more thoroughly than any interrogation ever could. "Mommy, why are you home early? Did something bad happen?" Elena had no answer that wasn't a lie. She pulled him close instead, breathing in the scent of his hair, holding him the way she'd held dying soldiers in field hospitals, like he was the most precious thing in the world, like letting go wasn't an option, like love could be measured in the tightness of an embrace. "Everything's okay," she whispered into his hair. "Mommy just needed to be home." The folded flag watched from the mantel like an accusation. Day 3 of suspension arrived with a phone call that Elena almost didn't answer. The administrator's voice was different this time, cautious, confused, the tone of someone who no longer knew what story she was supposed to be protecting. "Captain Martinez, we need you to report to conference room BO immediately. There are some people here who need to speak with you." Elena's hands went cold as she drove back to St. Michael's, back to the hospital that had been her cover identity, back to the place where she'd tried to disappear into the role of a basic floor nurse. She'd known this moment was coming, the moment when operational security would shatter like glass, when everything she'd carefully constructed over months would collapse under the weight of the truth. The conference room held Major Chen in a wheelchair, the hospital administrator, the state investigator, Dr. Pierce, and 2 men in army dress uniforms. The taller officer wore a general's stars and carried himself with the particular gravitational pull of someone who commanded thousands of lives. Elena's eyes met Chen's across the room, and he whispered hoarsely, barely audible, "Reaper 6. The silence that followed was the kind of silence that comes before earthquakes, before lightning strikes, before the entire world realigns itself around a single revealed truth. The general opened a manila folder with movements that were deliberately slow, deliberately measured, like a man laying out evidence that would reshape everyone's understanding of who they'd been talking to, who they'd been dismissing, who they'd been trying to destroy. "Captain Elena Martinez," the general said, and each word fell into the room like a weight. "Combat Medic Corps. Silver Star for Valor." The investigator's pen stopped moving. Pierce's face drained of color. The administrator's hands gripped the edge of the table. Captain Martinez held a forward surgical unit together for 18 hours under direct Taliban fire outside Bagram, performing battlefield triage while 3 surgeons evacuated. The general's voice carried no inflection, no emotion, just fact. She performed 147 emergency procedures in a single operational window. Saved 11 lives during a compound siege when primary medical personnel were incapacitated. Another document. Another revelation. The room was shrinking around Pierce, walls closing in with each sentence that emerged from the general's folder. "Your investigation, Dr. Pierce, prompted us to review all cardiac cases processed through St. Michael's in the past 14 months. 6 dosage errors, all originally calculated by you. 6 times Captain Martinez quietly corrected your calculations in the medical record. One of those errors would have resulted in fatal digoxin toxicity. The patient you attributed to underlying conditions, room 307, would be dead if not for Captain Martinez's intervention." The folder hit the table like a gavel. Pierce stared at Elena as if she'd transformed into something he couldn't comprehend, something that violated every assumption he'd built his career upon. Chen reached out from his wheelchair and grasped Elena's hand, a gesture that said everything: twice saved, twice protected, twice given a future because of the woman standing beside him. "She saved my life," Chen said, his voice hoarse but steady. "Twice. Once at Bagram. Once here." The general saluted her with parade ground precision. The sound of his heels clicking together echoed in the silence like applause. The suspension notice came by certified mail at 3:45 that afternoon, forwarded to her home address like something official rather than what it actually was, a sword held over her head by someone who didn't understand what he was fighting. Elena's hands didn't shake as she read it. Hands that had sutured severed arteries at 2 in the morning under mortar fire didn't shake over words on paper. But something in her chest tightened, a pressure like a blood pressure cuff that kept inflating, kept squeezing, because those words represented something she couldn't fight with competence or composure. The investigation was legitimate. The credentials were real. The cover identity as a simple civilian nurse from a civilian nursing school was exactly what the Pentagon had engineered, which meant that defending it without exposing the classified operation was impossible. She was still in her scrubs when Marco came home from school at 3:58, backpack dragging behind him like a reluctant prisoner. He found her at the kitchen table, still in her wrinkled uniform, the flag, SSG Ramos's flag, folded into a small triangle on the table beside the official paperwork. Elena's jaw was tight as a vice, but her eyes had gone somewhere distant, somewhere Marco couldn't follow. The boy stopped in the doorway, his second-grader instinct sensing that something fundamental had shifted in the world. "Mommy." His voice came out small, careful, the way children speak when they're afraid of making things worse. "Why are you home early?" Elena looked at her son, 8 years old with her eyes and her father's chin, a child who deserved a mother with straightforward answers, with simple explanations, with truths that didn't require security clearances. She had no answer that wouldn't be a lie. She had no answer that would make sense. So she pulled him into her lap instead and held him while he asked 3 more times in increasingly worried tones, and she kissed the top of his head and said nothing at all, which was perhaps the truest response she'd ever given him. The call came on day 3 of her suspension. Elena was in the gym at 0600 doing heavy bag work, her movements mechanical and precise, when the landline rang at 7:23. She didn't answer. The landline was never for her. But the caller left no message, and 12 minutes later her cell phone lit up with an unfamiliar number that somehow felt very familiar, the kind of number that came from buildings with no visible signage. "Captain Martinez." The voice was clipped, professional, male. You're needed at St. Michael's. Conference room B. 1 hour. It wasn't a request. It was a command. The kind of command that made her compliance automatic, muscle memory overriding the past 72 hours of humiliation and suspension. Elena showered in 8 minutes, dressed in civilian clothes because showing up in uniform would compromise everything, and drove to Norfolk with her hands at 10 and 2 on the steering wheel and her thoughts moving faster than her heartbeat could follow. The hospital corridor had changed. The same fluorescent lights buzzed overhead, the same scent of antiseptic and something underneath it that hospitals never quite eliminated, the smell of suffering, of bodies breaking down, of human fragility, but Elena moved through it like she was walking through another woman's life. The conference room door was closed. Through the frosted glass, she could see silhouettes, the hospital administrator, a woman she'd never seen before with a leather portfolio, Dr. Pierce with his characteristic slouch, and 2 men in dress uniforms that fit them like armor. The door opened before Elena could knock. The general, tall, grey-templed, with the kind of presence that made the air pressure change, gestured her inside. Elena entered with her shoulders level, her gaze steady, every inch of her screaming military bearing even in jeans and a button-down shirt. That was when Major Chen's eyes found hers. He was sitting at the far end of the table, still pale from the trauma, still moving like everything hurt, but his eyes snapped to hers with a clarity that made her breath catch. "Reaper 6, he whispered hoarsely. The room went so quiet you could hear the electric hum of the overhead lights. That was her call sign. That was a name that existed only in classified after-action reports filed at Bagram Airfield, in the field hospital where she'd held together a surgical unit for 18 hours straight while Taliban fire chewed through the sandbags surrounding their tent. That was a name that should have died in the mountains. That was her absolute worst nightmare, the operational security breach that would end everything, and it came from the mouth of the officer she'd been assigned to protect, the very breach she'd been suspended for trying to prevent. The general opened a folder. His voice was quiet, which made it more dangerous. Silver Star, for exceptional valor in the face of enemy fire, Bagram Airfield, December 2015. Citation reads, Captain Elena Martinez maintained surgical operations and casualty care under sustained indirect fire for 18 consecutive hours while 3 assigned surgeons evacuated due to medical emergency, preventing an estimated 47 preventable combat deaths and maintaining command and control of the medical team under conditions that would have warranted immediate evacuation by protocol. He paused. The silence stretched like a living thing. 2 Purple Hearts, for wounds sustained in combat operations. Another pause. And a Navy Cross, for actions that remain classified. He closed the folder gently. Captain Martinez has been conducting classified monitoring of military patient transfers through St. Michael's. Her assignment was to observe, document, and maintain operational security. She wasn't practicing beyond her scope. She was operating at a clearance level this hospital doesn't have. Dr. Pierce's face went the color of old plaster. His mouth opened, closed, opened again. I wasn't informed that a subordinate was, that she was military intelligence. This is a breach of protocol, my protocol as the attending physician. The general's smile could have frozen water. The investigation you initiated, Dr. Pierce, prompted us to conduct a comprehensive review of St. Michael's cardiac cases from the past 14 months. Would you like to know what we found? I don't think that's necessary. Pierce's voice had taken on a thin, desperate edge. 6 dosage calculation errors. All originally calculated by you. All corrected at the bedside by nursing staff you subsequently threatened or removed from care assignments. The general slid a stack of photocopied charts across the table. One of those patients is deceased. The family attributed his death to underlying cardiac conditions. We've consulted with independent cardiologists. The initial dosage would have accelerated deterioration by approximately 36 hours. The state investigator, the woman with the portfolio, spoke for the first time. Her voice was steady, professional, the kind of voice that had ended careers before. Dr. Pierce, based on the evidence presented, I'm recommending immediate suspension of your medical privileges pending a full board review. Additionally, the hospital administration has asked me to inform you that they're moving toward formal termination for cause. Pierce stood. His hands were shaking now, his jaw working like he was trying to form words that wouldn't quite come. This is ridiculous. I have tenure. I have patience. I have contracts that, he stopped, his eyes finding Elena's, and in that moment something worse than rage crossed his features. It was the look of someone realizing too late that the battle was already lost. You did this. You planned this. Elena didn't blink. She didn't move. She let the silence answer him, and the silence was more powerful than anything she could have said. Security will escort you from the building, the hospital administrator said quietly. She was already standing, already moving toward the door, already treating him like he'd ceased to exist. Your credentials will be forwarded to the state board by end of business today. The security guards, the same two men who'd stood at Pierce's elbow when he threatened to have her escorted out for questioning his dosage calculations, came through the door. They were polite about it, professional, the way security always was, but they were also immovable as stone. Pierce's mouth moved, his hands moved, his whole body went through the motions of protest, but nobody was listening anymore. The room had moved on. The world had moved on. He was a man trying to hold water in his bare hands, and everyone was watching it run through his fingers. 3 weeks later, Elena heard through the nursing staff grapevine that Pierce had tried to get hired at 4 different hospitals. The investigation followed him like a ghost. His medical liability insurance carrier dropped him by certified mail. His partners at his private practice voted to dissolve the association. The state medical board opened a formal inquiry. 3 previous patients' families, learning of the review, filed malpractice suits that the hospital settled quietly to avoid publicity. Each door that had once been open to him closed with a sound like finality. The final indignity came 6 weeks after the conference room. Elena was walking out of St. Michael's on a Friday evening, still in uniform now, captain's insignia catching the late afternoon light, when she saw him in the employee parking lot. Pierce was unloading boxes from a delivery van, wearing a uniform shirt for Tidewater Medical Supply, his name stitched over the breast pocket in letters meant for people nobody would remember. He saw her, and his hands froze mid-motion. For a second their eyes met across 30 feet of asphalt, and Elena saw in his face the full weight of recognition, that he had been right to fear her, wrong to underestimate her, and utterly unprepared for what competence really looked like when it finally stood up and stopped apologizing. Elena nodded once. Not forgiveness. Not respect. Just acknowledgement. The arc had completed. The folded flag of SSG Ramos, the one she'd carried as a constant reminder that some sacrifices were permanent, that some debts couldn't be repaid but could be honored through competence and silence and absolute refusal to break under pressure, that flag now sat in a shadow box on her mantle, no longer hidden. And Dr. Pierce watched her walk toward the hospital entrance, and then he looked away first, which was perhaps the most important thing that happened that day. Elena continued toward the doors in her captain's uniform, no longer hiding, no longer silent, no longer carrying the weight of a false identity that had tried to make her smaller than she was. 3 months later, St. Michael's would host a formal ceremony. The hospital administrator would present a civilian commendation. The folded flag would sit on the podium in its shadow box. Marco would watch from the front row with Major Chen beside him, finally understanding why his mother had scars, finally seeing her the way the entire hospital now saw her, as someone whose quiet competence had been worth more than all of Dr. Pierce's credentials combined. If you've made it this far, you know that what we choose to see in others defines who we are. Subscribe for more stories where the quietest person in the room turned out to be holding it all together. Hit that like button, drop a comment about a time you were underestimated, and turn on notifications so you never miss a video where heroes wear scrubs instead of capes.